Have you ever noticed that an older family member or friend that's just had surgery doesn't think as well after surgery? Well, it hasn't been clear up until now, until they just did this study, whether it's from the surgery, the anesthesia, or dementia.
Right. So what they did, and this was a study that was published in the Annals of Surgery in September of 2012. So they did a study on mice who had a predisposition for Alzheimer's disease. They had the APOE4 defect that puts them at risk for it. And the surgery that they did used a general anesthetic. So they did two things. One is they anesthetized some of the mice, and that's all they did. And to the second group, they anesthetized them, and they did the surgery. Then they looked for changes in how their minds worked, and found out that the mice that had both the surgery and the anesthesia were the ones that had the problem, and the one with the anesthetic really did pretty well. So we answer our question that it's the surgery that does this. It's not so much the anesthesia.
And isn't that interesting? I always thought it would be the anesthesia and the surgery.
Yeah.
I don't mean and the surgery. I thought it would be anesthesia and the drugs.
Yeah, well, that's right, because there are lots of drugs that are given in addition to the gas that you inhale. So now that we know that's the case, the question is what actually happens with the surgery? And what they discovered is that there was an inflammatory reaction that occurred in the rats that had, or the mice that had surgery, which isn't a big surprise because they're getting lots of trauma. They're doing like an appendectomy or taking part of a colon.
But it's interesting that it causes inflammation in the brain.
Well, the inflammation that's in the body apparently can get across the blood-brain barrier and get into the brain. And so the question we have to ask ourselves is, what do you do in people who are older who may have a risk for developing Alzheimer's or have maybe just a minor case of Alzheimer's disease to start with?
Well, I would think twice about having surgery. I mean,
Indeed.
It would have to be absolutely necessary.
Right. I would really avoid doing an elective surgery if you could avoid it, because why would you want to take the risk of deepening the dementia that occurs with Alzheimer's? But if you're going to take somebody to surgery, there are some things that you could do that may protect against this happening. One thing for sure is if we know there's going to be inflammation, we can use antioxidants, right? We can load them up with the antioxidant vitamins A, C, and E and others to try and protect them against that, and maybe give them some berries for breakfast for a few weeks before that to build it up. And then
vitamin D.
Vitamin D is a beauty. We know that actually keeps Alzheimer's disease from progressing at such a fast rate. So I might be inclined to measure a vitamin D level, see what it is, and then supplement appropriately.
Another thing that's helpful is coconut oil. We talk about this on our website on drsaputo.com.
Right. So the dose that I would give is about 2 tablespoons 3 times a day. And what that does is it really provides with another source of energy besides glucose. When the brain in Alzheimer's disease starts to fail, the problem is there's like an electrical brownout, meaning that there's not enough ATP, which is the chemical energy that the brain depends on for its function. And when you add coconut oil, it gives us another source of energy called ketone bodies that are very safe and healthy for people who have this problem.
Well, there are a few other things too, like niacinamide and curcumin.
Right, and you can use choline, which is something that helps make acetylcholine, which is that neurotransmitter that seems to be in short amounts in people who have Alzheimer's disease. And you can use essential fatty acids and vitamin B12. All these things working together might be exactly what you need just to make sure people don't decompensate if they have to have a surgery. Then, of course, there's the standard things that we use to prevent Alzheimer's disease or slow it down.
Exercising your brain.
Both of those, right, and lots of social interaction. So if we do all these things, based on this study that's published in a major medical journal, we may have a solution that will slow the process down and make surgery for our elderly patients who are predisposed to Alzheimer's disease do a lot better.